My internship at JCWO. So it's going to be in three parts. First of all, we're going to start with an introduction of what is the Jacinto Convit World Organization. Then we're going to talk about the activities that I've done during the internship, and we're going to finish with the conclusion and the recommendations. So, introduction. So what's JCWO? The Jacinto Convit World Organization is a public charity incorporated in 2014 in California, which is dedicated to providing access to healthcare and treatments to those in need while training new generations of professionals, like the interns, me in this case. Just let me click. Okay. So what's the history of JCWO? As we said before, it was founded in 2014 by Dr. Jacinto Convit, and due to as a tribute of Dr. Jacinto Convit, and it focuses on global health issues, but in a more specific way. What I did, it was about ConvitVax, which is the vaccine used to treat breast cancer as an adjuvant, like it's an immunotherapy adjuvant to normal therapies like chemotherapy or radiotherapy. So as said previously, it's named after Dr. Jacinto Convit, which is a renowned Venezuelan physician and researcher, which is best known for his work on leprosy and leishmaniasis. As we talked about it before, he has made very important advancements in these two diseases that were thought to not be treated before. And he has helped thousands of lives and countless amount of people. So what's the main work of JCWO? First of all, as you said before, there is the cancer immunotherapy using ConvitVax, which is the personalized, safe, and potentially effective breast cancer immunotherapy. We wrote potentially because it still hasn't been it has been tested, but it still hasn't been commercialized, if I can say commercialized. But as we will see later on, it is 99% likely to be effective and safe. Other than that, JCWO also does molecular diagnostics, which where they provide early, specific, and free of cost diagnosis for people of all ages and genders affected by various types of cancer. So it's as it is an NGO, it is obviously charity work, and they do not JCWO does not tax. They don't make the patient pay for these services, which may be very determinant. It can be very determinant in the life of the patient to access those molecular diagnostics. So what were my activities during this internship? The first activity was to present an article that was released in 2015, which is Autologous Tumor Lysate Bacillus Calmette-Guerin, Immunotherapy as an Adjuvant to Conventional Breast Cancer Therapy. So, of course, for the rest of the presentation, I would say BCG instead of Bacillus Calmette-Guerin. This article was the first one that I read from JCWO, and it discussed the development and the immune response that was induced by the novel breast cancer vaccine, which is the ConvitVax, and which was formulated with autologous tumor cells. And as we saw in this presentation that I did at the start of the internship, we saw that formalin was also an important factor of the vaccine for it to work properly. So after conducting an uncontrolled study on the small group of patients which had, in this case, breast cancer, it was found to be safe and feasible to conduct this treatment, and that it had a 60% survival rate at a 5-year follow-up for the combined treatment, which was more than what expected before. And it showed that this treatment is useful as an adjuvant, and it can be integrated into conventional treatment strategies. So the main goal of this treatment is to be added to chemotherapy and radiotherapy, for example, to make somehow life easier for the patient, as chemotherapy and radiotherapy are very destructive. So this first presentation gave me the chance to learn more about this innovation that I did not know about before starting the internship. And the positive results that I read about in the paper, they showcase how there is still room for new creations in the domain of cancer research, how cancer research can still benefit from new innovations and can still benefit for improvements. And in general, it also introduced me to the domain of innovation in cancer research. So after that, I had a second activity, which was another article published 3 years later that talked about the same vaccine, but in more depth, and it was another type of study. So it discussed the development and the immune response induced by the breast cancer vaccine, but it was there were different tests that were done, and it was a somewhat longer study that tackled with more depth the vaccine's efficiency. Sorry. So the second study made me delve into the work of JCWO with more details, and it showed, and obviously the second study also showed positive results, which were described as a significant decrease in tumor growth and mitotic index. They only confirm what Dr. Convitt stipulated at first. His hypothesis was that the fact that using immunotherapy as an adjuvant for classical therapies can only be beneficial. So the third activity that I presented, it was still a presentation, and it was the last one related to JCWO directly. It was a toxicity study on the Convitvax. So it's obvious that when you have a new product, a new innovation, we can't just base ourselves on the results, on positive results. We also have to check if there are any off targets, if any of the effects are undesirable on the patient. But fortunately, in the study, there was a 0% of negative impact of the vaccine. If I remember correctly, in the study, the toxicity showed didn't show any. There was no sign of toxicity shown, and it showed that the vaccine doesn't have any side effects that can add to the burden of the patient that is already conducting other therapies like chemotherapy and radiotherapy. So my last presentation was about an article that I chose, which is the switchable CAR T cells in cancer treatment. So switchable CAR T cells are, in my opinion, one of the most interesting papers and one of the most interesting subjects I've read in my scientific life till now, because of its novelty, because of how recent it is, the discovery is, and because of how potent it is and how we could actually achieve something with it. So it talks about how we can improve CAR T cells, which are chimeric antigen receptor T cells. And by adding a switch, we can change the strength of the immune response of the T cells, and we can also change when we want to activate it, or how often we want to activate it, for example. So it was really an interesting paper to read, which led me to write an article about it, which was the final activity at JCWO till now. It's the writing of the publishable article that will be published on the website, on the press room of the website. I honestly think that this activity was the most beneficial for me because I am quite used to write presentations and present articles, as I've done this in my degree of biology. However, writing an article wasn't something that I've done so many times, and by doing it, I learned how to prepare an outline, how to find references for the article, what form it should take, and I had the chance to experience the many processes of writing an article. Even though it's not a scientific review or research article, it's still worth a lot for my scientific life. And obviously, I could not have done it without the help of Dr. Carvalho, who offered me counseling concerning the information and the form of the article. So, a conclusion and recommendations. In summary, my experience at JCWO was significant for my personal life and my professional life, as it gained me knowledge that I could not have had access to in another way, and it gave me experience that will obviously be used later on, let it be on the presentations or on the writing of an article. I don't have a lot of recommendations, but the main recommendations I have is about the writing of an article part. So if the intern would have, I don't know how feasible it is, but if he or she could have the chance to write more than one article or focus on the writing part, I think that this could be only beneficial to him or her, because as much as it's important to read the articles and to present them, I feel like by writing an article, like discovering this full process, it can teach them how it will be later on if they go into research, for example. And like, I don't know if it's only personal, but the presenting an article is something that personally, like at my university, I've done quite many times. But I think that this can be personalized for the student, for the intern. For example, maybe some interns wrote more articles than presented, and so they would find it more beneficial to present the articles. So it's only personal recommendation. It's not something, of course, absolute. And the last one is quite, like, it's very far-fetched, but if it was possible to assist in a publishable, like official review or research article, like as a volunteer, maybe not directly write about it, but just assist in it, it would be the most beneficial experience. But this is very, like, I don't think it's very doable, as you have many interns at the same time, and it's not something that can be done easily. And so I want to finish with a quote of Dr. Convitt, which I like. I really, really like. I can't really read it in the original language, so I'll just read the translation, which is, "The greatest lesson in life is to do good to those who suffer." And I think that it summarizes well his the legacy that he wanted to leave, and how we should use his work and his will. Thank you for the whole internship, and thank you for letting me present.